All right, we're going to get started. Good morning. I'm State Representative David Clark, representing the people in District 98. The House passed House Resolution 829 that calls for a select group of bipartisan legislators to examine fraud in our welfare programs, and I'm honored to chair this important study committee with my remarkable colleagues. I'd like to say a thank you to all the departments for the work you do here in Georgia for the needy. I know it's not easy handling so many applications and verifying eligibility and trying to catch the fraud that comes with it. So my colleagues and I are looking forward to digging deeper into seeing what we can do to help you and your departments catch those who are frauding the system, draining your resources and stealing your time, and ultimately are taken away from those who truly have need. To be clear, I just want to lay out the mission and the purpose of this committee. First is this is about assuring that resources are available for those who need welfare, Medicaid services now and may in the future. In order to do this, we must work to remove individuals as quickly as possible that should not be on these programs. Number two, we want to learn where in Georgia they are being successful in fighting fraud, waste, and abuse. And number three, by identifying additional gaps that allow for fraud, abuse, and misuse to continue in our various entitlement programs, and the barriers that are in place preventing their detection. So the plague of fraud endangers the safety net programs created to help the neediest among us. In fact, the Department of Behavioral Health and the Development Disabilities reports that there is a waiting list for those with special needs to get services. And so those who commit fraud steal money that could be going to help special need families from getting the services they require. The impact is also felt in other areas of our budget. Any dollar that is misused translates into fewer dollars for our kids, classrooms, our public safety efforts, and higher taxes for everyone in Georgia. Fortunately, new technologies increase the probability of identifying fraud and abuse, and this committee will explore them. I'm also worried that for the first time ever, Americans think the next generation might be worse off than their own. That's a moral crisis wrapped around a huge taxpayer liabilities and weakens local economic growth. And we need to protect our resources for the truly needy and be good stewards of taxpayers' money at the same time. My hope is a final committee report will make key suggestions for potential policy changes. So let's get started. First up, I would like to have up from the Department of Community Health, Jonathan Duttweiler and Elizabeth Brooks.
Good morning, Mr. Chairman.
Good morning.
And good morning, committee members. Thank you for giving us the opportunity to talk to you today. I am Elizabeth Brooks, and I am the Program Integrity Director with the Office of Inspector General for DCH, the Department of Community Health. The Office of Inspector General looks at both provider and recipient fraud. We use other state agencies and resources to help us determine where this fraud is occurring, and then we use our manpower. We have 4 recipient fraud investigators, and we have 3 provider investigators that are assigned to all the fraud that we have. Prior to the start of the meeting, you should have gotten a handout. And if you can see in just last year in fiscal year 15, in the waiver programs, that means that we've got waiver programs from the Centers for Medicare and Medicaid, we've identified over $3 million in recoveries. In Medicaid Fraud Control Unit, that they do our provider fraud for the state of Georgia, we already have 8 referrals from July 1st of 2015. We also have 3 more that will be sent over to them and then approximately the next month. We had 9 referrals last year. Then we also have a RAC, which is a vendor who looks at other providers for us. They have identified over 12 million in fraud. As you can see, last year we brought in approximately $25 million from our investigations for provider fraud and recipient fraud. Now, recipient fraud is handled by the district attorney's office in the counties the members reside in. The majority of these numbers will be from provider fraud. We have, to help us combat with provider fraud, we have a 1-800 number for everybody on our website, and we also have email addresses so anyone can report fraud to us anonymously. And then we send it to our investigators to investigate. Any tip we get, we do investigate that tip. And that's it. Thank you.
And my name is Lisa Marie Shekel. I'm the Director of Communications and Legislative Affairs with DCH, and Chairman and members of the committee, I wanted to thank you for inviting us today. As you had indicated, fighting fraud, waste, and abuse in these programs is very important to ensure that the members that need these resources do have access to them. Elizabeth had provided just a very high-level overview of what our Office of Inspector General within DCH does, and Jonathan Duttweiler, our Assistant Chief of Member Services and Policy in our Medicaid program, is going to provide an overview as it relates to DCH's responsibility in working with eligibility determinations and primarily working with our vendor, or for lack of better words, DFACS through the Department of Human Services. And Jonathan's also going to talk not only about our current processes that we go through and work with DFACS on, but talk about the future and where we're going with our integrated eligibility system.
Good morning. So let me talk just a little bit about the relationship of the Department of Community Health to the people who, in the majority, do most of the eligibility work. We contract with both the Division of Family and Children's Services under the Department of Human Services, as well as Maximus, to do eligibility work for Medicaid and the state CHIP program, which is Peach Care for Children. So Maximus does Peach Care for Children. DFACS does the vast majority of Medicaid eligibility determinations for Medicaid itself. And of course, then we also have an agreement with Social Security Administration for doing Medicaid eligibility for recipients of SSI that's communicated directly to us. In the current environment, most of our, and I'm going to speak, I guess, to the data matching and what kind of data sources we're using currently. We do have a eligibility system that is maintained by the Department of Human Services called Success. You may be familiar with that. It does interface with a number of federal and state interfaces in order to do checks against the information that the citizens might give us who are applying. We interface with the Department of Labor right now to get DOL and unemployment compensation, with the child support STARS system to get child support information. We also interface with the State Data Exchange and the Bendex Exchange and the SIEVs from the SSA administration, and we get some IRS data through their BEERS interface as well. That allows us to check against Social Security income, SSI income.
Sure. If you could break down some of the acronyms, because y'all love those. Yeah. And for those of us who are kind of, on that learning curve, you talk about beers, and I think cold ones. Unfortunately, I should have made it. Some of them I'm so used to calling by acronyms, I don't remember what they stand for. SDX is State Data Exchange. I will say they all involve what I named are all state, federal, or federal exchanges with SSA and the IRS that involves SSI, RSD, Supplemental Security Income, which is basically disability payments for individuals who did not pay enough into the system in order to be eligible for regular Social Security, disability, RSDI, which is retirement survivors disability insurance. That's what people get who become disabled or retire and have paid into Social Security. Typically, people just lump that as Social Security, right? So BEERS is essentially the IRS data information that we get from the IRS. So do excuse me if I drop into acronym speak. I do apologize for that. Essentially my point was that we are currently we also interface with vital records and public health. We get immunization data from public health. We get birth records and citizenship data from vital records. We also get citizenship data from the federal government. All of those are automatic interfaces for the most part. There are some manual interface work. A worker actually has to go in and do that check. But these are part of the routine checks that are done when we have somebody apply for not just Medicaid, but across the federal benefit programs environment of benefits. So that is currently pretty much what the current environment, the extent of what the current environment does. There are additional checks that case managers do from a manual point of view. They do income verifications. We do have a contract with the TALKS Corporation, which does some income employment verification for us. So workers at DFACS, for example, when they get somebody who indicates they're employed, they can go into the TALKS system, and if that company has contracted with TALKS, they'll get actual employment verification just as if they got their paycheck from them. So that's one other set of verifications that we do as well. Let me talk a little bit about our future state and where we expect to be going in the next year or two. As you're probably aware, DCH is the lead agency working on an integrated eligibility system. We are partnering with the Department of Human Services, the Department of Public Health, and Department of Early Care and Learning in order to build a integrated eligibility system. That a couple of the main components, one of which is an enterprise master person index, which at this point the only system that is integrated is the DFACS system, which has Medicaid, TANF, and food stamp program in it. So we get a good match where there are individuals applying cross benefit, but what we don't know is when an individual is in WIC or an individual is in CAPS, one of the child care program supports, we don't always know those individuals are the same. So one of the things that the Enterprise Master Person Index, or EMPI, will do for us is if somebody applies, there'll be a common portal through which they'll be able to apply for all of those programs. We'll be able to match that individual up if they've are already known to our system and applying for a new benefit, or if they apply, all together. We'll be able to match them up and have information in there for that individual that we'll be able to share across agencies. So if somebody reports a change in one agency, that's going to be indicated or communicated to the other agencies working different programs as well. So we're looking at that is helping us clear out duplicates and avoid issuing duplicate benefits or benefits to people or having changes in their benefits that all the agencies don't know about. As part of the IES system, there's also going to be a fraud, waste, and abuse component. That's going to do some basic analytics against the information that a citizen gives us and compare it against various public and private data sources. That'll sort of give us a sort of a reliability score
and could red flag information when it doesn't match up or doesn't seem to comport with the information that comes back or is checked against in those databases. And so it'll let a worker know things that they need to follow up or dig more closely into. Also, a lot of the or all of the interfaces that I just mentioned are going to be automated in that system, so that the system will actually go out and hit those sources against the information that's entered into the integrated eligibility system. We've also obtained fraud, waste, and abuse services from a group called Pondera Incorporated, and they're not only going to provide analysis of fraud, waste, and abuse at a vendor and provider level, but they're also going to provide deeper investigative activities and case management for investigations. And I'm sure our friends at DHS will speak probably a little more on that as well. The pilot for that system is set for May 2nd of next year, and we're on track to meet that date right now, so we're very excited about that. You had asked about identifying places where the processes are in place for cross-agency data sharing, and I think essentially that's in the integrated eligibility system. Currently, the Department of Community Health also gets what's called the PARIS file, and PARIS is Public Assistance Reporting and Information System. That's a federal conglomerate of data from all the 50 states that are reported, basically around individuals who are on public assistance of almost any type, and it provides us with when they've applied for and are receiving benefits in multiple states at the same time, when there may be a discrepancy on federal income being reported, when there's a date of death that's reported, and so we get that information as well. So there's a myriad of information in that PARIS file. Right now, that's sort of a manual process. The department gets that, passes that along on a quarterly basis to DFACS, who then has to investigate and look at each one of those individually to make sure that those they follow up the data is accurate and then apply that data. That's an intensely labor intensive process right now. That's going to be automated also in the IES system, where we will consume that file, be able to do some task generation around what comes across when we have a member known in the system. That'll generate a task out to a worker who will then be able to follow up. Then our report backs will also be automated as well in the system. Some of the additional resources, and again, this is mostly will be involved in the integrated eligibility system, but some of it is being done today. I'm not sure how familiar you are with what's known as the NAC initiative. That stands for National Accuracy Clearinghouse. That is an initiative within 5 southern states around sharing food stamp and TANF participation data. I'm sure our friends at DHS can speak more to that. Currently, that's sort of also a manual. That will be a process that will be integrated into the integrated eligibility system as well, so that we'll get those files on a daily basis. That essentially does the participation in the food stamp and TANF programs for those 5 southern states, including Georgia, where we see duplicates and benefit issuances, things like that. So I've talked a lot. I hope I've kind of dealt with your main concerns. Are there any other specific questions that I could answer around the eligibility and enrollment universe?
Can I go back over something?
Sure.
The system that you're talking about going in place in May, though, that system will also integrate the 5 southern states, and that will help us check if somebody's employed in another state?
It won't check employment. What it will do, and what I was speaking to around the NAC interface, is that it will give us eligibility participation in food stamps and TANF in those 5 states. So if somebody's participating in one of those other states and we have them participating in Georgia, we'll know that.
Okay.
Yeah, the employment, the departments of labor of each state are pretty protective of their specific employment data.
Mm-hmm.
It's also fairly expensive to get just within our own state. So there's no mechanism that I'm aware of sharing the actual labor department data.
So that is potentially a hole that we may have if somebody along our vast borders are employed somewhere else, living in Georgia, applying without a job in Georgia.
It is certainly a possibility.
Okay, thank you, sir.
I have a quick question. What are you doing with? I was looking into like doctors when they happen to do Medicaid fraud, and I know back in 2012 we had 8 doctors here in Georgia who had done Medicaid fraud in other states, changed address, and came to Georgia. I was wondering, what are we doing? Do we have anything in place to catch that and verify the doctors who are moving here? Have they created Medicaid fraud, and what's happening? Because that's taking money from the needy who need it, and they're probably going to be doing the same thing here unless they have changed their ways.
Well, the Department of the Office of Inspector General does have constant communication with other states, and we do talk about providers that have it. Also, that information is supposed to be disclosed to the licensing boards, and the licensing boards are supposed to notify us if there's problems with that they get suspended elsewhere or in Georgia. And that is something that we do look at and take into consideration. When we search out providers, we do searches of their background to make sure that they are able to practice and become Medicaid providers.
Yep.
So what is the percentage of companies that are registered with TOPS? Is everyone registered, or is it just big businesses, small businesses?
They actually have over 5,000 companies of varying sizes right now across the country. So it is not 100%. It's not universal. And if we cannot verify through talks, then we do request third-party verification. In other words, we'll ask the applicant to actually, provide their check stubs or get a statement from their employer. It's widespread, their coverage, but it's not 100%. It doesn't sound like a lot, but they hit most of the major employers in a given area. So people like Walmart and I can't think of all the employers off the top of my head, but they hit most of just about all the Fortune 500 companies, so anybody's employed by one of them, and then multiples of other companies.
And the reason why I ask that is because I've seen a lot of people make their own paychecks. It's
Yep.
easy. In
Sure.
2015, people could make their own paychecks.
Sure.
And if there's only 5,000 registered with the system, which is not a lot, you could work for an apartment complex or you could work for anywhere else and make your own paychecks and then put back into the fund.
And we check that against the Department of Labor, whatever the Department of Labor reports as well. So when there's a discrepancy between something that's in the Department of Labor system and something that we are given, then we have to clear that up. That's obviously a red flag at that point. And so the expectation is that the eligibility worker would investigate that further. You're welcome.
Are there any more questions from the committee?
Just so I don't regret not asking the question, is there ever a process by which you would make recommendations on some concerns that you have about addressing fraud. And I'm just throwing that out there in a broad context of almost any area of the what you deal with. Is there a process by which you make recommendations to someone that would be put before a committee like this to look at some policy changes where you see clear areas of open doors of fraud?
I'm going to let our legislative
So,
liaison.
if I'm understanding your question correctly, we have in the past, as I understand it, probably several years ago now, worked with the legislature on some things that would tighten up some things, and especially in our OIG area. 2 years ago, we had a piece of legislation that you all were instrumental in getting passed. At this point in time, we haven't identified anything new that may help us as it relates to items that might be tightened up in statute at this point, but certainly if we identify anything, we will make sure to report that back to y'all.
All right, thank you so much for speaking today.
Thank you.
And then also, if Jonathan and Elizabeth, if y'all could stay around after just for a little bit in case we have a few questions towards the end, that'd be awesome. Next, we would like to call up from the Department of Human Services, Ashley Fielding, and also from the Department of Family and Children's Services, Maurice Ingram.
My name is Ashley Fielding. I am the legislative liaison for the Georgia Department of Human Services. In the department, we have 3 divisions, one of which the director reports directly to the governor. That's the Division of Family and Children's Services. We also house the Division of Child Support Services and the Division of Aging Services. In our department, we also have our Office of Inspector General, which investigates fraud, waste, and abuse in Georgia's food stamp and temporary assistance for needy families programs. I want to start out by thanking you, Mr. Chairman and Madam Secretary, members of the committee, for inviting us here today and providing us with the opportunity to discuss our fraud detection efforts that we've developed in the Department of Human Services. I have with me today Mr. Maurice Ingram. He leads the department's benefit recovery unit. I don't know if you are aware, but our department's Office of Inspector General is widely recognized across the country as one of the most aggressive in investigating, identifying, and eradicating fraud, waste, and abuse in public assistance programs across the country. As a matter of fact, Georgia leads the Southeast in the establishment of fraud claims in the food stamp program and is in the top 10 in the country in establishment and eradication of fraud claims across the country. I want to give you a little bit of background about what programs the department administers. These include food stamps. On the federal level, this is called the Supplemental Nutrition Assistance Program. Probably across the next couple of weeks, we will slip and we will call it SNAP. I am not talking about something you do to make rhythm. It is our food stamps program. And then what we generally refer to and what has been historically referred to as welfare is the Temporary Assistance for Needy Families program. We will slip at some point over the next couple of weeks and call it TANF. TANF, by and large, ever since 1996, when welfare reform was enacted, has a work requirement. It is a time-limited program. Recipients cannot stay on the program for longer than 48 months, except for in certain circumstances, the period can be extended to 60 months. The other, in Georgia, because the work requirements are as they are, most of the people who receive TANF benefits in Georgia are children in the foster care system or children who have been diverted from the foster care system because they have a relative who has just stepped up to take care of them. Georgia is also a leader in work participation rates for those recipients of TANF who are required to participate in work. In 2011, Georgia was only behind North Dakota in participants who made their work program requirements. I will say North Dakota had a bit of an advantage over us in that they have much fewer people than Georgia has, and also much fewer people who are eligible for the program. Our food stamps program is a much larger program here in the state of Georgia. It affects about 1.8 million people across the state. The average size of the household that receives food stamp benefits is about 2.5 people. I'm not sure how they got that number. But the gross income must be 130% of the federal poverty level for those folks to be eligible for those benefits. When I say 1.8 million people, we're talking about 900,000 households in the state. I don't want to take up too much time, but I do want to make sure that you are aware of ways to report food stamp fraud and TANF fraud in the state of Georgia. We have a line that is operable every single day. It's and easy to remember. It's 1-877-MY-GEORGIA-DHS. We also, like our friends in the Department of Community Health, have a anonymous reporting method over the web and through email. And I don't want to say too much about the, or I can't say enough about the integrated eligibility system that's coming online next year. What it will do, in layman's terms, I believe, will create almost a bionic OIG for our department, because we will be able to, in real time, verify what an applicant is telling us across all programs, what they're telling, for example, child support, their income is, what they're telling DCH what their income is. We will also, in real time, be able to verify their statements about their income with other federal programs that are set up for us to do that, which now we may receive that in a batch document on a quarterly or a monthly basis. But at this point, I want to open up the floor for questions, because I know you probably have more questions than I have information to provide.
Thank you for being here. I do have a question, and this was somebody asked me this, so I'm not positive of all the implications here. We require single parents on TANF to meet the work requirement, which you did mention. But we have also applied for a waiver for the able-bodied adults with no kids on SNAP. Can you explain that to me a little bit more?
Absolutely. TANF is a much smaller program. We have about 19,000 families across the state who receive TANF benefits. Of those, 14,935, nearly 15,000, are child-only cases. Those are the ones I was talking about, who are children whose relatives have stepped up to care for them.
Mm-hmm.
And so those children do not have a work requirement, and the people who care for them do not have a work requirement, because the child is deemed eligible automatically. In terms of what we call the able-bodied adult without dependence program, is what you're talking about, in the food stamp program. Georgia traditionally had that program statewide, in 2009, when the recession hit, unemployment levels were such that it was difficult to sustain that program, especially without state support. As a little bit of background, the food stamp program is a federal program administered by the state. The benefits themselves are 100% funded by the federal government. The administration of the program, the costs are shared 50-50 between the state and the federal government. We had states or counties that had unemployment levels that were far above the national employment level. The rule is if the unemployment level is at least 36% above the federal average, then that county can be waived of the requirements, knowing that there may not be jobs available in a certain area for that, for the state to make it mandatory. The other side of that is that we have to provide employment and training staff. We have to have infrastructure for resources to those individuals as they are referred out, and to make sure that they are getting employment and training, involved in employment and training activities. We don't have the resources in place currently. We currently have a few challenges ahead of us that we have to address first. One of those, if you are not aware, I'm not sure if this has been provided to the committee members yet, is a federal penalty that could be assessed if the department does not begin to administer its benefits in a timely manner. During the recession, we also lost a good bit of our resources in terms of staff and had a difficult time getting eligibility determinations done in a timely manner. Because we did that for our timeliness rate was lower than the standard for 2 years in a row. Mm-hmm. We have to get it back up to the standard by June of 2015 or face losing that 50% share of the federal government's costs in administering the program. That's one of our first priorities currently. But we also have plans to bring that program up statewide. We want to do so in a way that leverages the most federal dollars possible. If we were to stand it up today, we would have to share those costs 50-50. I do want to clarify, though, that the program is operable in many counties. One in particular is in Hall. We do not have a waiver in Hall County. We do not have a waiver in Gwinnett County, and we do not have a waiver in Cobb County because the unemployment levels are in line with the national unemployment levels there. So the program is mandatory in those 3 counties. We also have a pilot program in several metro counties. While we still have the waiver, we still are requiring recipients to come in and participate in the work program. They will be suspended for 1 month if they do not participate, and then we'll assess them further after that.
Follow up, Mr. Chairman.
What counties will be waived next year? Do you know?
Yes, sir. Cobb, Gwinnett, and Hall are the 3 counties where we have the full mandatory work requirement. We have about 6 other counties, and I could not name them off the top of my head currently, but I will get them to you, who would not qualify for the waiver, but do not have enough population in their county that falls into that category of able-bodied adult without a dependent to stand up the program there. And then again, we have about 18 or 28 counties that have the pilot program, and I have a map that I can provide to you as well that shows you those counties.
So no urban areas will be waived. I mean, nowhere in the state it shouldn't be.
I want to clarify that the federal waiver applies to 153 counties. Cobb, Gwinnett, and Hall have a mandatory program, no waiver. There are another, help me with my math, 5 counties, or I'm sorry, yeah, another couple of counties that have been waived because of their population.
Okay, thank you.
So I'm just trying to understand.
Sure.
Apologize. We have about how many able-bodied adults on that system now?
I have to follow up with you
Okay.
on that number. I know that last year, through our pilot program, we had about 7,000 people who enrolled. Of course, there were a number of people who did not show up for the work participation activities, and I don't have a count of those right in front of me, but then they would have not participated in the program anymore.
And then you mentioned we have a staffing issue.
Absolutely.
What can you talk to us about that? What do we need to know to help in that area? Two areas. One, you said the actually work training. If you could expound on that just a little bit, and then just staffing in general, that'd be great.
Sure, absolutely. In 2008, the need for food stamp benefits and the number of people applying for those benefits grew exponentially.
Right.
Our resources for administering those benefits did not grow at the same rate. What happened at the time was that leadership in the department decided to try and streamline the way that benefits were administered. So traditionally, you would go into your county office, you would fill out a paper application, you would get a call back from a caseworker who was your caseworker, and you would have to do an interview. You would come back later, you would provide verification of your income, all that sort of thing. But as our resources shrank during the recession, what we decided to do was go to more of a conveyor belt approach. So the person who showed up in Gwinnett County might call a centralized line and have their interview. They would be talking to someone maybe in Fulton County or maybe in Ben Hill County, whoever was the next available person to help them.
Mm-hmm.
What that was meant to do was to make all the resources available into the state to the person who was in need at that moment. We did not have enough resources to do that in a timely manner, and we ended up in a difficult situation in terms of providing benefits and providing access to people. We had more people calling that line than we had people to answer the phone. We have moved back to what we call our one caseworker, one family model. That takes away that conveyor belt approach where the next available person would do the next piece of work that needed to happen on your case, to where one person owns your case and handles it. We're already seeing a lot of improvement there, and our complaints have gone down. They've been cut pretty much in half since we've implemented this program. We have moved most of our work off of that centralized phone line so that our clients can reach us when they need us to in the local office. And you'll have to repeat your other questions.
No,
'cause I
that's
may
fine.
not have
And so I'm
answered
just, there is a great concern amongst anybody constituent-wise that I talk to about assistance programs in general, about the able-bodied folks without kids. And so if you can give us any information to help, tell us about that program, perhaps, just get some more information out there so we understand. And we can answer those questions. I think for me, specifically, that's a major concern.
Absolutely, and if you would afford me the opportunity, we might be better to come back and discuss that program and what the population of Georgia's food stamp recipients looks like across the country. From my understanding, the majority of our recipients do work, and about half of the ones who fall into that able-bodied category also provide work. They are just underemployed. I can tell you that one of the things that we have just received to help with those folks who are underemployed or chronically unemployed is we applied for a grant with the federal government and received $15 million to do almost like a CMO for employment and training services for those people who just cannot get a job or cannot maintain a job. So we're working with the Technical College System of Georgia, the Department of Labor, Behavioral Health and Disabilities, the Department of Corrections, everyone working through the same system to identify what the issue is that's keeping a recipient from getting gainful employment and a career, because we do know that that reduces the cost of the food stamp program if you are able to get someone off the program because they have a sustainable career. Sure. And they would not return. But if you would allow me to,
sure,
to
I'd
provide
love
you
to
some
follow back
information,
up with you on that.
that'd be great.
Question: what if someone moves to an area where it's been waived? Or, I mean, how is the eligibility handled in that? Like, what if somebody goes, okay, I'm going to move over there and not have to have a work requirement? How does that work?
In the food stamp program, you have to recertify your eligibility every 6 months. Where you live is assessed at that time. Where you know, your income is reassessed at that time. All of those things are reassessed. So if the person then is eligible for the work program, they would be put into it at that time.
Representative Erica Thomas, do you have a question still?
Yes. Thank you, Chairman. So my question is, I have two questions. The first one is that you said you refer to the welfare as TANF. Are you talking about the SNAP benefits as well? Is that under the same bridge?
No, ma'am. Those are two different programs.
Okay, got it. So you don't refer to the SNAP benefits as welfare?
No, ma'am. Generally, welfare is considered temporary assistance for needy families.
Okay, so I have a question about the SNAP benefits.
Okay.
So on average, because I know you said 48 months for TANF, on average, how long are people in Georgia on the SNAP benefits?
Let me check. I'll have to follow up with you on that one for sure.
Would you say that it's longer than 48 months?
Because there is not a component for SNAP, there's not a time limit on that federal program. We don't generally pull regular reports on how long a recipient receives SNAP benefits, but I can do some further checking and follow up with you.
Just because of the research I've done on my own, it's really, I don't want to say 4 years, I don't want to say how long exactly, but it's a lot of time that they're on it. Okay. And so I didn't know, since that's not declared as welfare, even though at some times that could be $500 a month that they're getting, or $600 a month that they're getting. I just wanted to know how long it is, and then, of course, how are we measuring that? I know that every 6 months they have to go back in, TANF, and that's the same way with SNAP benefits as well, right?
With TANF, you recertify once a year. With SNAP benefits, you have to recertify every 6 months. So you have to prove your eligibility for the program every 6 months.
And then my second question is, with the proving of the eligibility, is that the same thing with, are y'all using TALK as well?
You want to speak to that?
Yeah, and I wanted to clarify one, because I don't want a misconception to be on the table. Even though you recertify every 6 months, there is a requirement in the SNAP program that if your circumstances should change, that are different than what they were when you applied, you have a responsibility to report that. So if I started out and I was only making $15,000, and then I all of a sudden started making $80,000, then I have a responsibility to report that to the department. If you don't, then my office would become involved, and we would look at that frame of time and consider you not reporting to be a fraudulent activity. So you're correct that you certify on TANF every year. You certify every 6 months on SNAP, but you are required in both programs to constantly provide us with notice if your circumstances should change outside of what they were when you applied.
Okay, thank you for that. So you're saying that it's easy to catch it? Or is it, tell me how that works, because, if I certify it in terms of IES, and I get a job in the next 3, if y'all don't catch it, then, I cannot, because I've heard before people have come to me to where they don't come back after 6 months. It's just over. Nobody comes after them and says, wait, where were you the last 3? It's just like, I don't serve
Absolutely, and I think that is a misconception that we hear as well. I think Jonathan was very shy about what the IES system is going to be able to do for us, because in leveraging those private and public databases, we actually look at a person's eligibility for the past 7 years. So when you come in, when you apply to our system and that information is housed in our eligibility system, then we're going to constantly be reviewing the Department of Labor, the Department of Revenue, starting to look at credit reporting agencies. So we're going to see if there's any indication that the information that you provided to us at the point of application, which we consider to be our gateway, has changed. And if that information has changed and you haven't been forthcoming with us on that information, then we are aggressively pursuing you. And I guess the best example that I can give you is we look at household composition cases. And so if you apply for benefits and it's a mother and a child, and all of a sudden the boyfriend moves into the home who's the father of that child, in food stamp it says you have to report the presence of that father in the home and you have to report that father's income. Most people don't. But our robust system will allow us to look at addresses to say, okay, what address are you reporting to driver services for your driver's license? So if we have 2 addresses in the system and we see that someone is on one of the benefit programs, well, why is this other person in the home? Should this person be included in your food stamp application? Have you reported information to us about this other person? So it is a delay in our opportunity to find them, but we're very aggressive and our system gives us those indicators so that we can pursue them.
Well, that's good to hear, because I was a little discouraged because when you said that we don't have enough staff really to get people in. I mean, we have enough staff that are actually looking to see people.
And I think that's one of the things that we want to highlight. We have 116 dedicated staff here in the state who look at issues of fraud, waste, and abuse for TANF, SNAP, and child care. As Ashley mentioned, there is no better state than Georgia when it comes to establishing fraud claims for all of those programs. We are recognized both at the regional level and the national level. There is opportunity for us to do a lot more. And I think one of the things that we will see with the integration of our eligibility system is right now we kind of pay people and chase them after the fact. Having those kind of fraud analytics that Jonathan talked about at the front door of our eligibility system allows us to do some predictive analytics, which will help us say, okay, if Maurice Ingram applies next week and he provides information under these certain conditions, we have other applications that have been submitted with those same kind of conditions, and we've identified those cases as being fraudulent. So we have a high probability that the case that Maurice is providing to us may be fraudulent, so we need to look at that case even closer. Also, leveraging the data sharing that will be in the system will allow us to look at behaviors in other programs so that we can determine whether or not those individuals who have been removed from other programs are applying for other programs, that we need to look at them and make sure that they're not penetrating those programs as they did the other programs. So I think in today's environment where we have a mainframe system that allows us to be very labor intensive, which causes us to be very labor intensive in our fraud investigations, I think that new integrated eligibility system, the data analytics, the fraud analytics that we're going to be able to leverage in that system will allow us to do a much more robust job. Mm-hmm.
The chair would like to recognize Representative Larica.
Thank you, Mr. Chairman. Heard Ashley and Mr. Ingram, heard both of you mention about what a good job Georgia's doing at trying to identify some of this fraud and abuse. But with one of my ears, what I'm hearing is that Georgians are more dishonest than any other state. And I think part of that can come from human nature's attempt to take that path of least resistance and try to take advantage of those programs that we're offering. And again, going back one step further, it almost makes me think that we're leaving the door a little bit too wide open, because I think if the guardrails and fire breaks were already in place to prevent them from being eligible in the beginning, that they would not have the opportunity, nor would they be as willing to try to be dishonest in qualifying. So certainly, I don't mean to make that sound like you're not doing a wonderful job, because I know that you are. We've done the research from home and with some help of good people. But we'll just want to make sure that we look at this thing from every angle. That I think the reason we're catching a lot of fraud is because we got a lot of dishonest people, and we're making it easy for them to receive the benefits that they shouldn't. So just a comment on that.
And actually, I would mention, and that's a point well taken for us, that you asked Jonathan about some of the feedback that we provide to improve our system. One of the things that we constantly do is we actually look at the environments that our fraud investigations are in. So when we analyze those, what we do is we look to see if there was a barrier in our system that was not well fortified, that allowed the opportunity for that fraud to come in. So we're constantly communicating with the eligibility side to say, hey, we have 1,500 cases that are coming from this particular address in this neighborhood. Can we start looking at these cases closer to make sure that we're asking additional questions so we're not allowing those cases to come in from those areas? We're constantly talking about eligibility requirements and where we have the ability to manipulate those eligibility requirements to prevent fraud from coming in. We provide that kind of feedback at the state level. We also are constantly engaging our federal partners. Two of the best examples that I can give you is a couple of years ago, it was just rampant with people going on social media and selling food stamps. It was Georgia who was the one who went to the feds and said that's unacceptable, and we need to have rules changed at the federal level that allows us to combat that kind of activity. And the feds in 2013 changed their rules to allow us to prosecute people for social media. And Georgia was actually the first state in this country to successfully prosecute a food stamp recipient because they went on social media and attempted to sell their food stamps. So I always say this good old country boy believes that we have to be hound dogs when it comes to fraud. I agree with you that we're always going to have some of those people who are on fraud who may be a little bit smarter than I am and my staff, but we are constantly looking at ways that we can improve our business processes and influence the eligibility processes so that we can combat fraud as much as we can.
Thank you. Question: what do y'all? When do you think we can reinstate the entire state with the work requirement? Like, what are y'all looking at? What do y'all need? And what's the timetable? Do you have a timetable?
That plan is actually being developed currently, and what I'd like to do is, if we come back next time, to present to you what our plan is for moving that statewide.
Awesome, thank you.
While leveraging the maximum amount of federal dollars we can for the program.
Awesome, thank you. And why I'm asking that is, I know a few years ago, I knew somebody like my age, and he was bragging about how he had it down, with the system, doing the 48 months, come off it, and he's back on within so long. And he was bragging about it. And so that's why I know we need the work requirements and have it down, because there are some people who wanted to fraud the system. And this was somebody I knew personally. I'm like, are you kidding me? Because there are people who need it, and I know with me, why I wanted to head up this study committee and all that is, from, the past, serving in the military, for 6 years and all that, serving overseas, there are people who need it so bad. The disabled who are on a list right now here in Georgia who need help, and they're not able to get on it. And we could be using some resources. Any bit helps to help, clean that up and get them the help that they need. And I know there has to be other young guys around my age who are doing that exact same thing. And, it kind of upset me when I heard that. I'm like, I want to go off on them. I did with words, but that was it. But it just, it really upset me. So that is why, I'm looking forward to y'all next time, when y'all finish up looking at when we can reinstate it. That would be awesome. Sure. Thank you. Are there any other questions with the committee?
Just a quick follow-up to Mr. Ingram's comments. Do we have a written report of some sort that you give back to, I guess, your manager, supervisors, either quarterly, annually, with what you mentioned? These are some areas that I think we need to try to look at. Is there a written report that goes back to say these are some fraud that we've detected? This is what we believe the cause is, and I believe some of what we're trying to do up here could be handled within the departments, and then reports given. I don't think you have to draw up new legislation every time something's uncovered, but certainly Chairman Clark is going to try to work hard to see if we need to do that. But if there's not a written report of some type that's given back to the agency from your department, I think that there could be. I think that there should be. And I don't think that has to be done legislatively necessarily, but to just say, hey, these are some areas you might want to take a look at.
I definitely think that's an opportunity for us, and I'll get with Ashley. I know we meet often to talk about those things, but I think, having a formal process.
Right, yeah, and that's what kind of struck me. You mentioned a number of times that you meet to talk about it, and which is great. I'm not jabbing at you at all. I think what you do is a great job, but I think to have it in writing is a paper trail for us to go back and look at, or for the department to go back and look at and say, Mr. Ingram comes back and says, well, Representative Clark, I've put it in writing 3 different times about looking at this area, and nobody's addressed it. CYA or something like that.
Question, do y'all track when and where TANF cash is accessed? Like, say, like the time of day or area, like matching it versus like high crime areas, and reporting it to law enforcement. Maybe something with that data can help out to see if there's fraud going on.
We track TANF data, and we track TANF transactions in real time. So while we're sitting here, if you ask me how many transactions were held at Publix or the local corner store, I could get on my BlackBerry, get on my phone, and tell you how many occurred. Currently, the initiative that we have around TANF is looking at the Middle Class Tax Relief Act and looking at what the legislature in Georgia passed to say, laws in Georgia that we passed to say transactions shouldn't occur at certain locations. So every month, if we have TANF transactions that occur at liquor stores, if we have TANF transactions that occur at cruise ships and casinos, that information is provided to our office. And then we go after those recipients, one, to remind them what the requirements are of TANF, which means you can't go those places, and then 2, to hold those people accountable and get those funds returned back to the state. So it's a yes and no to your question. Looking at crime areas and those kind of things, we don't do it at that level, but looking to make sure that those transactions are occurring in locations that are in line with the rules and regulations of the programs, we absolutely do that.
While we're on that subject, I know there's been some other states over the last few years that have put identification on the cards to help try to avoid selling the cards for whatever reason. Do we have any data from those states if that's been successful, and have y'all talked about doing anything similar?
Other states have provided data concerning that issue. I think we can supply that to you. And one thing I would mention on that particular activity, when it comes to SNAP, the SNAP program at the federal level says that you can put anybody's picture on the card. So if anyone who's living in that household could have their picture on the card. TANF is a little bit different, and there are some stricter requirements there. But when people elect to sell their benefits, they're going to find a way. And
Sure.
Without giving some of the clues away, most of the time what you have occurring is that there is a relationship with the cashier at some of these small and pop stores, and that's really where you're having your greatest penetration of EBT trafficking. One of the things that we're beginning to do is to actually work with the Department of Agriculture here in Georgia, and also working with our federal partners to look at the places in Georgia that we're actually authorizing EBT benefits. So if we have a store that's in an area that may not be as desirable as it should be, and if we've already disqualified that store once from participating in the program, is it a good idea for us to go back and authorize that store for EBT again? So that's the kind of thing that we're constantly engaging our federal partners, engaging other state agencies to do to try to combat fraud when we're seeing it at our level.
Okay.
So it looks like I might go in undercover.
You can always come with me. I'd love it. Yeah.
So I have one more question. It might be on one of these sheets that we have here, but in order to get this to us, what is the most that a family can give on TANF? I mean, I've heard some things that TANF doesn't really give that much, so I just want to kind of hear, like, is it
on average, it's I want to say less than $148 a month.
What if, just a question, what if they had the photo ID on there, you know, and I know you say, okay, well, they have the hookup, you know, with that convenience store. I know, say, you have to show your license to buy liquor, and if they don't check the ID, and there can be a sting operation, so if you see a high crime area, then you set up a sting operation there, then if they are doing that, then they should pay for that, you know. So I don't know if that would help out. I mean, I don't want to go extreme either, so it's like, oh, you know. But I think maybe have a penalty maybe that would help out clean up a lot of those areas from hooking up their friend, you know. I don't know. Just a question and a suggestion.
One of the things I can say is that we work with the federal government on these rules when, you know, we're considering them. A couple of years ago, there was legislation passed that would have actually required a photo ID put on food stamp EBT cards in the state of Georgia. One of the requirements would have been that retailers treat an EBT card recipient the same way that they would treat anyone else who is using an electronic debit card. So, for example, when I go to the gas station and I swipe my card, no one ever looks at it. It's on the other side of the counter. You've got to scrape. So there would be some additional requirements for retailers as well that we would need to consider and also put in place training for as well.
Any other questions from the committee? Awesome. Thank you so much.
Thank you.
Hey, Senator Renee Oderman, if you'd like to, you're more than welcome to come up here, if you like.
Or you can sit there and enjoy your lunch. Either or.
Well, thank you for joining us.
I'm sorry. I'm late. It's my bad.
Next, I would like to have up Josh Archambault. He's from the Foundation for Government Accountability, and he had flown in, and I heard he was in town, so I wanted him just to give a few minutes to talk to us about what he's seen in the welfare system.
Chairman Clark, distinguished committee members, thank you very much for this opportunity. As the chairman said, I just happened to be in Atlanta, so appreciate this opportunity to talk a little bit more about waste, fraud, and abuse that we're seeing in other states and opportunities for Georgia. My name is Josh Archambault. I'm a senior fellow at the Foundation for Government Accountability. We are a nonprofit think tank dedicated to working with state leaders to reform their health and welfare programs. We're currently working in about 25 states and aim to provide background research and facilitate the sharing of best practices across states to help reform our broken safety net program. And for those that are curious, our headquarters is in Naples, Florida. Today I wanted to cover at least one reform that we have seen show exceptional results in other states. We call it Stop the Scam, and can save hundreds of millions of dollars in one of your budget's biggest line items, Medicaid, but it can also ensure that those that qualify for welfare programs make it onto the program, only those that are qualified, and those that are no longer eligible are removed as soon as possible. So I want to focus on how Stop the Scam can protect resources for the truly needy, saves taxpayers millions of dollars, and frees up resources for other priorities. Now, I want to, before I explain exactly what this is and what it has looked like in other states, I do want to make one mention here about the integrated eligibility system that we've heard a little bit about today. This is a initiative that almost every state is taking under the ACA. The federal government put up a 90-10 match to do so. And one caution, word of warning, while the potential is great for these programs, the implementation has been mixed at best in other states. The programs, and I hope this is not the case in Georgia, I'm not meaning to imply otherwise, but they often have been late, and when they are up and running, the outcomes have not always lived up to the promise. So just to keep that in mind, a word of caution as we move forward, not to say we shouldn't pursue them, but just to make sure that we're looking under every rock as we move forward. Now, those integrated eligibility systems do move us closer to the hope of a closer to real-time eligibility redeterminations, but we have already talked about, Representative Barr mentioned a couple of the gaps that could exist around the states around you or looking for national data across. What is different about Stop the Scam is that by hiring a third-party vendor, they have built national databases. It is under their responsibility to get the information about new hires in the state around yours. It can be a bridge until your integrated eligibility system is up. It can be an enhancement to it. It's not a new system. It can be as basic as sharing an Excel spreadsheet with the vendors for them to check their national databases. Think of it as a national credit check, if you will. Now, federal rules currently require for Georgia and others that on Medicaid, you can only do eligibility redetermination once a year unless you're given a reason to do it. These vendors give you a reason to do it. Now, the Stop the Scam initiative came out of a bipartisan reform in Illinois in 2012. And let me tell you a little bit, share a brief story on why these things matter. Jacob Chalky is a young man that I've gotten to know who lived in Illinois, and Jake's mother calls him her miracle child. Jake suffers from a life-threatening seizure disorder. Now, doctors told Jake's mom that he would never walk or talk. There's only one drug that reduces Jake's seizures, yet Jake has been at the receiving end of the state of Illinois cutting his benefits twice. Now, there were a number of pressures in Illinois that were leading to this, but you can imagine the anguish that has been for his family as his seizures can land him in the hospital and are a serious threat to his health. Now, reform was needed to prevent these sorts of future incidents for Jake. Now, in Illinois, in 2 years since implementing their bipartisan reform, they've found a cumulative 650,000 individuals that are believed to be ineligible on their Medicaid program, saving almost $600 million. That translates into a return on investment of almost 9 to 1. Now, this included removing 8,000 people who had passed away, some as far back as the late 1980s, and the program's been so successful in Medicaid, the new governor is expanding it to other welfare programs. Now, I know what you might be thinking. Illinois is a mess, and it is. But in my home state, I live in Boston, Massachusetts, the new governor there is moving along in a similar process, and they have removed 205,000 ineligible people, with many more cases for them to review. They're projecting savings of almost $400 million in the first year. Arkansas recently did some redeterminations and found that 50% of their Medicaid recent enrollees were actually ineligible. In the state of Minnesota, in a discussion about a similar reform, they projected $300 million of savings. And in Pennsylvania, they did a slightly different approach, but focused on data sharing across state agencies. Under the previous governor, they saved $160 million in just 10 months. Now, the Independent Nonpartisan Government Accountability Office has identified deep issues with our current eligibility practices in all states. And in my assessment, Georgia is doing many things well. In fact, when compared to their peers, they are ahead of the curve in many ways. But there are still gaps that exist. We heard a little bit about the NAC program, and I think this illustrates a perfect example. While depressing, some of the early results that will be released, I'm hearing relatively soon, are encouraging that states can coordinate better and make sure that folks aren't on multiple programs. We've seen stories here in Georgia. There was one relatively recently of a woman who was still on Medicaid in Tennessee, but had been living in Georgia for quite some time. Those are the situations you want to try to cut down on. Now, another example of some of the eligibility issues, another recent GAO report found 10,000 individuals that were concurrently receiving Medicaid benefits in 2 or more states. They only looked at 5 at different ends of the country. Now, Georgia was not one that was examined as part of this analysis, but Florida was. In addition, very concerning, and I'm sure the folks who run Medicaid are very aware of this, another GAO study came out estimating that Georgia had roughly 215,000 Medicaid enrollees who also have private coverage, and about 340,000 who have another form of public coverage. Now, why this matters is it raises serious concerns about the possibility that Medicaid is paying for services first, when in fact it should be the payer of last resort in almost every situation. It's an area, third-party liability is the technical term, an area that's well worth spending some time making sure we understand what Georgia's doing and if there's other opportunities to improve in that area. Now, it's our estimate that based on the experience in Illinois and in other preliminary states as they've moved forward, it's conservative to expect that these sorts of reforms would save somewhere between 2 to 4% of your total Medicaid spending. This would translate into about $175 to $300 million in total taxpayer saving, or $60 million to $115 million in general revenue for just the state. Now, we did hear a little bit about transitions and maximizing federal resources. I want to remind us all that Georgia taxpayers pay federal taxes as well. So we must be mindful that while you are very concerned and interested on state budget impact, you should also be concerned about federal impact. The last thing I will note about these sorts of reforms is that as Georgia has moved towards managed care, or has for a while now, it's of utmost importance that you find out if somebody gets a new job or is moved in April or August instead of at the end of the 12 months, because you will have been cutting the insurance company a check for every month before that. Now, I'd be remiss if I did not mention a couple other opportunities for significant savings by closely examining the eligibility process for both TANF and SNAP, as we have heard what those programs are. For every new job that's been added in the private sector in Georgia since 2000, 28 individuals have been added to food stamps. Even though poverty rates are declining, the number of people receiving food stamps has remained stagnant. There's a problem here. Now, while it's hard to believe, and we heard some questions here about this able-bodied population, since 2001, Georgia has seen a 1,221% increase in the amount of childless households on the program. There are roughly 200,000 childless adults in Georgia. That was 2013 data from the USDA, so the population that we were talking about before. The concern here is that as we talk about the work requirement, nationally, 75% of this able-bodied population report no earned income. Now, I'm sure the data is slightly different here in Georgia, but that's national. This is deep concern for long-term dependency. And we know nationally that people are not on the program for a short period of time. Roughly 25% of enrollees are on the program for 8 years or more these days, and almost 50% have been on for over 4 years. That's why I think this discussion about work requirements is so important as we look at the future economic growth for Georgia and making sure that the 28-year-old, we're not talking about work requirements for grandma, we're talking about grandma's 28-year-old grandson who's still living in the basement, that we're making sure that we're getting those folks the skills they need to get them off some of these programs. Now, national surveys do show that there's wide bipartisan support for work requirements on these programs. In fact, FGA has done polling, one of the largest national polls of folks that are currently on welfare programs or have been on welfare programs. And we were surprised to learn, I think others were as well, that a majority of people on welfare support work requirements, even a stronger work requirement than the federal law currently sets. Almost 70% of folks that have been on welfare but are no longer in our working support them for when they would have been on the program. Our poll also found that welfare dependency has a dramatic effect on quality of life and the hope for a better future. And while these programs are federally funded, as was mentioned before, we should be mindful that research has shown that as folks' enrollment increases on SNAP and TANF, typically it has a spillover effect on other state-funded programs, particularly Medicaid. So we want to make sure that we understand the link between the two. Finally, I just mentioned, because it was brought up before, there have been a number of states who have implemented IDs on their EBT cards. The data that I have seen has come from the state of Maine. It's cost them about $1 a card. For them, their biggest issue was cards were being trafficked for drugs, although I think Mr. Ingram is right that often there's a convenience store component here as well. But they were seeing many cases where there were drug busts and somebody would have 20 fully loaded cards, and they would say, well, I'm an authorized user for all 20 of these people. and law enforcement found it very difficult to prosecute them under that situation. Now, the state of Massachusetts has also put photos on their EBT cards. The state of Missouri is moving in that direction as well. So I do think that there is an opportunity to learn from what those states are doing and see if it's something that might be appropriate here. So I do thank you for this chance to come before you, share a couple brief things. I'm excited about the commitment that Georgia's showing in taking the task of fighting welfare fraud abuse seriously. I think we'll have a better state and a better country as a result, and FGA staff stand ready to assist in any way that we might be able to. Thank you.
Thank you, sir. Where did you find that number that you quoted, the 200,000?
So it's federal data from the USDA. I'm happy to get you the report. That's, again, it's from 2013.
Okay.
The latest data that I've seen.
Thank you.
Thank you, Mr. Chairman and committee members, for allowing me to join you on the panel, and thank all of the presenters this afternoon for the valuable information you shared here this afternoon. But I just mainly have a comment I just want to inject in this discussion of welfare fraud. In addition to serving in the General Assembly, my husband and I are in the mortuary business. So I've came across cases where elderly individuals receiving food stamps, Medicaid or Medicare, ended up being a beneficiary of their family members' life insurance policy. Individuals that were on TANF ended up being recipients of receiving benefits from life insurance policy as well. So I just want to just kind of make that point, just to something to consider as you're discussing welfare fraud, that life insurances could have an impact on this discussion as well, as individuals are receiving those type of benefits. And how would you be aware of that? You know, how do you monitor? How do you work through those type of situations? So just want to just share that comment, and thank you again.
Yes.
And Mr. Chairman, if I could just say a good point, and another area that might be of worth consideration is making sure that every program is checking lottery winnings. I know it sounds a little bit unrealistic. However, we have seen the state of Michigan, the state of Maine do some preliminary work and find actually a surprising amount of individuals who have won the lottery in the past, did not self-report. Now, they may not be eligible the month that they receive the lump sum, but do end up on the program in the future. Might be an area to examine. The other one I would say is making sure, and under the integrated eligibility system, this may be part of it built in, is making sure that the agencies are doing the best job possible, that when somebody is deemed ineligible, that information is quickly shared with other programs to make sure that they do a redetermination to see if that individual is still in fact eligible. We want to make sure that people that are eligible for programs get it, and those that aren't don't.
Thank you, Josh. Would any of the departments, would they like to come up or say anything regarding anything Josh said, or any additional comments? Does any of the committee have any other questions they'd like to ask anyone who has spoken today?
Just wanted to say this again. I'm probably bad about saying things I shouldn't, but if they're on TANF or SNAP, I hope they're not playing the lottery.
I just want to say thank you so much to all of you today for coming out and speaking, and I'm looking forward to, as we move forward, looking into helping the truly needy, and just thank you for all of you for caring about people so much. I know all of you in your jobs, that is why you're wanting to work in these areas, to help those who need us most. So thank you so much, and you have a great day.